I educated. That was the first thing. The program had early intervention program, PEP program in London. Had psychoeducation for the families. That was critical. I went separately myself down there with my partner for that. And the other thing was connecting with the family support group there. I stayed within the mental health community at that point. I didn't even really talk to my family too much. I didn't know too much about what was going on. It was just, there's this disease happening and I'm kind of freaking out because my boyfriend went through this and I didn't know if my daughter was going to go through the same thing, and I've just, you know, going through the motions, going through the steps. But here's these things that they told me they had. They had an education group, they had a family support group. So I did all those things because I knew that I didn't have access to those things, and it was a terrible outcome. So it was just autopilot, you know, and connecting.
We started by speaking to the family doctor. We made appointments for our son to see the family doctor, and each appointment was broken because he wouldn't go. And then we started watching talk shows and going to meetings and gathering information. And the turning point came one night in May 2002 when I attended a FAME meeting, and I came home with a book entitled Learning About Schizophrenia, Rays of Hope, published by the Schizophrenia Society of Canada. And the book opened up my eyes to the seriousness of mental illness. And I remember that I felt that I had left one universe behind and I had stepped into a new universe, and that my life was changed forever. And this knowledge that I received was a tremendous gift.
There comes a trial and error period during which various medications were tried. And the first two medications that were administered had some pretty serious side effects. And that was very, very difficult. So my son's dad, because he has a background, he is a psychiatrist, actually took an initiative and contacted a colleague. And when our son was placed on yet a third medication, things began to improve tremendously. On the basis of finding the appropriate medication and the appropriate dosage. So this took place over a long period of time, however, probably about 2 years. It was probably about 2 years before the medication began to have a positive effect. And our son's behavior and mood began to improve, and stability, stability was achieved.
I was hospitalized for a number of weeks with my illness. I then did like a 3-week kind of course and different coping mechanisms and things like that as an outpatient of the hospital. I continue to go to the hospital and see a psychiatrist who maintains my medications at the proper levels. I don't tell too many people that because of the stigma, but I mean, if I had diabetes or something, I wouldn't be afraid to tell people. So it's important for people to understand that it's not your fault. It's in my case, it's a chemical imbalance that is quite well addressed with medication and the proper community supports. So just keep reaching out until you find the people that are going to help you within the community, and band together, and don't be ashamed to ask for help because it's not a weakness.
Look in my geographic area for what services are in the catch basin of where I live, and how can I get to them. And you start to prioritize them, and you find out who's got the longest waiting list and who's got the shortest waiting lists, and how can you circumvent things. And you can get pretty Wile E. Coyote-ish, and they say the squeaky wheel gets the grease, and there's a lot of truth to that old adage. And that's what I tell family members all the time. keep hammering and chipping away at things and keep asking hard, tough questions.
Don't give up. It's a frustrating experience, especially when you're just starting on the journey and you're coming up against barriers and everything seems to be negative and you're so frustrated and there's so many waiting lists. And don't get frustrated. Don't give up, because there's so much help out there.
The more your disappointment and your hurt feelings kind of envelope you in a buffer, the longer it's going to be to go forward. So I think the biggest thing I can offer from my family's experience and the experience I've had with my brother directly is to take some time to obviously go through the emotions you're feeling and start to look outside of the family for people to talk to and information, and to start building bridges outside. So a bridge can be to your GP. A bridge can be hopefully to a psychologist if there's some talk therapy involved, to a psychiatrist if you're lucky enough for medication, to a family support group to learn what other families go through, to talking to your friends and other family members, and you're soon going to find out that you're not the only family going through it, that everyone has a family member or a good friend or a spouse that has gone through these situations, and you're going to find out that there are a lot of resources, and that's going to make you feel a lot better about the situation, which is going to make you feel calmer and more positive and more accepting, and that is kind of the energy that needs to be invested in that will get you through that kind of road that you need to take between the time when your family member is first going through their situation to the end of the road where they're feeling back into some sort of balance. And the family has a feeling of being on solid ground again.